Hello, my name is Tom Iovino, and I'm speaking to you on behalf of the Disaster Recovery Leadership Network. I would like to share some important disaster preparedness information for human service agencies here in Pinellas County. First, let me tell you a little bit about the Disaster Recovery Leadership Network. The network is part of the Health and Human Services Coordinating Council for Pinellas County, and its mission is to ensure that priority human services are made available to the public at the earliest opportunity should a major disaster occur in Pinellas County. The objectives of the network are to help ensure that health and human service organizations in Pinellas County are optimally prepared for any major disaster, to work with community partners to develop and implement plans that will ensure that all Pinellas County residents have access to health and human services during long-term recovery from a major disaster, and to facilitate coordination and communication amongst network stakeholders during all phases of a disaster. Core members of the network represent organizations that are generally countywide in scope and either have clear emergency management functions or are a major funder of health and human service programs in Pinellas County. The disaster preparedness information and operating guidelines that I will be talking about today are found in the Disaster Recovery Leadership Network's communications plan, and the agencies that are covered under this plan deliver services such as child care, basic needs, and behavioral health care. The plan does not apply to hospitals or residential facilities. The communications plan is designed to guide human services efforts in Pinellas County, Florida, after natural disasters and emergencies, including but not limited to hurricanes, tornadoes, high winds, and flooding. To ensure notification of all staff identified to execute the plan, provide guidance in establishing the objectives of restoring services, facilitating communication between participants, and coordinate short-term assistance. To complement Pinellas County's Board of County Commissioners' Comprehensive Emergency Management Plan, and to promote interagency and intergovernmental collaboration in concert with Pinellas County disaster response and recovery efforts. Here is how the plan works to provide guidance and standard operating guidelines for agencies and the Disaster Recovery Leadership Network prior to, during, and following a disaster. Prior to a disaster, the Disaster Recovery Leadership Network encourages every human services agency to have a viable continuity of operations plan, often referred to as a COOP plan. It is designed to help ensure the continuous performance of an agency's essential functions during an emergency, to protect essential facilities, equipment, records, and other assets, to reduce or mitigate disruptions to operations, to reduce loss of life, minimizing damage and losses, and to achieve timely and orderly recovery from an emergency, a resumption of full services to customers. A manual has been developed to help human service agencies prepare and maintain their continuity of operations plan, and it's called the Scoop on COOP, a workbook for human services continuity of operations planning and disaster recovery. It is available on the Health and Human Services Coordinating Council's website. On the site, you will also find many of the worksheets from the Scoop on COOP in a Microsoft Word format, and you are free to adapt them to your agency's needs. To summarize, prior to a disaster, agencies should ensure they have a continuity of operations plan and it's regularly updated. They should also conduct exercises to test the components of the plan and, when possible, test the plan in its entirety. When a disaster is imminent or has occurred, agencies should execute their continuity of operations plan, emphasizing first and foremost the safety of their clients and staff. It is important for all employees to have a personal disaster plan to ensure the safety of their loved ones and minimize damage to their personal property. Without robust personal disaster plans, employees will not be able to execute an agency's continuity of operations plan. To summarize, when a disaster is imminent or has occurred, agencies should execute their continuity of operations plan. The focus should be on protecting life and property. Following a disaster, and as soon as it is safe to travel, the Disaster Recovery Leadership Network will be establishing a Recovery Management Center. It functions as an extension of the Emergency Support Function 8, the Health and Medical Services Desk at the Emergency Operations Center. Part of an agency's continuity of operations plan should indicate the staff responsible for conducting an assessment of that agency's status and providing an agency status report to the Recovery Management Center by calling 211 from within Pinellas County or 727-210-4211 if calling from another county. Web-based forms are also provided for this purpose on the Health and Human Services Coordinating Council's website. The agency status report gathers information such as whether the agency is fully operational, partially operational, or not in operation, how many clients the agency is capable of serving, and if they are currently serving any clients at this time, staffing capacities and the agency's ability to staff their program and operational, as well as to determine their ability to share staff with other organizations. Information about the building to determine if it is fully functional or if the agency or programs have relocated. This includes questions about electricity, water, phone service, internet service, and if the roadway is accessible, and requests for assistance. The information gathered via the agency status reports is stored in a database where it is analyzed. After assessing all available information and recommendations from the Recovery Management Center team, managers may authorize and direct available human, material, or financial resources to help agencies restore and/or maintain priority human services. Managers may also request specific assets from the Emergency Operations Center for this purpose. To summarize, following a disaster, agencies should complete an agency status report by calling 211 from within Pinellas County or 727-210-4211 if calling from another county. Links to electronic forms to complete agency status reports will also be provided on the Health and Human Services Coordinating Council's website. During recovery, the Recovery Management Center will augment and support the work of the Emergency Operations Center. With your help, we will ensure that priority human services are provided to the people of Pinellas County as soon as possible following a disaster. Please familiarize yourself with the steps that your agency should follow prior to, during, and following a disaster. Additional information and resources can be found on the Health and Human Services Coordinating Council for Pinellas County's website. Please help spread the word about the Disaster Recovery Leadership Network's communications plan and this video to colleagues both internal and external to your agency. Thank you.